the second part of our presentation on psychiatry emergencies. Okay, so in the first part of our presentation, we looked at suicidal attempts as a psychiatry emergency. We looked at aggression as a psychiatry emergency. We also looked at depression as a psychiatry emergency. So in this lesson, we are going to look at three more conditions that constitute psychiatry emergencies. Okay, so in our psychiatry emergencies, we are using the mnemonic sad dad, a dad who's very sad that students are failing a subject like mental health, which is so simple and so easy to learn, so interesting to learn. So, alcohol intoxication is the fourth condition that we are looking at as a psychiatric condition. Okay, so within this lesson, we are going to establish why alcohol intoxication can be looked at as a psychiatry emergency. Okay, so we establish that to understand what alcohol intoxication is. We will also have a brief pathophysiology of alcohol intoxication. Then after that, then we'll look at other conditions that we have to consider, like drug abuse, okay, or substance abuse, okay, and also the other condition there that we'll still discuss within here. Okay, so by definition, alcohol intoxication is a physiological state that is induced by consumption of alcohol. We have chosen this definition for the purpose that, there are some it is the first time, so we cannot have an amount, okay, to say 300 mils, 400 mils will constitute alcohol intoxication. So, for those that have been taking alcohol, it might take a bigger amount for them to reach alcohol intoxication levels. Okay, but for those that are taking beer for the first time or alcohol for the first time, you might see that they just need a small amount in order for them to suffer from what we are calling or what we term as alcohol intoxication. Okay, so some clinical features of alcohol intoxication may include slurred speech, okay, euphoria, impaired balance, loss of muscle coordination, okay, the fancy medical term for loss of muscle coordination, we call it ataxia. There is also flushed face. We see dehydration. Okay, dehydration will come because there is frequent of mutilation or frequent of urination by the person who has taken a lot of alcohol. So it may result in dehydration. Okay, dehydration may also come because of vomiting. Patient may severely vomit. So vomiting becomes one of the clinical features of alcohol intoxication. Other other clinical features of alcohol intoxication include reddened eyes, reduced inhibition, and erratic behavior. Okay, after taking alcohol, your behavior may not be the usual behavior that maybe people might have known you for. Because of the intoxication, find that the behavior of one slightly changes. Okay, sufficiently high levels of blood-borne alcohol will cause coma and death from depressive effect of alcohol on the respiratory system and the central nervous system. Okay, so that is all we can discuss on clinical features. Okay, you have to imagine someone who has taken a lot of alcohol, they cannot walk the normal way they walk because of alcohol intoxication. They have ataxia, they have flash face, dehydration may come because of vomiting. Okay, patient may vomit a lot, they will have flash face, and then there's reduced inhibition. Okay, then let us appreciate the causes and also other effects of alcohol. Intoxication is the consequences of alcohol entering the bloodstream faster than it can be metabolized by the liver. Some effects of alcohol intoxication are central to alcohol's desirability as a beverage and history as the world's most widespread recreational drug. Okay, so alcohol has been used for centuries as a recreational drug, so a lot of people take it. So, common effects of alcohol when one takes alcohol, you see euphoria, you see lowered social inhibition, and others. Okay, That other effects that you can see in alcohol is that they may bring about progressive and long-term harm when consumed in excess. So we see progressive, harm that is brought to a person in terms of the way in their social pattern and other areas. Self care also becomes a problem because of alcohol, because of one taking alcohol, because of alcohol intoxication. So we see some self care deficits. Okay, so now we can also look in terms of signs and symptoms, or clinical picture. We can also look at the stages of alcohol intoxication. Okay, we have these stages. Please let it not come out strangely to you that we have stages, but otherwise, is to appreciate at each and every level what are some of the clinical presentation that alcohol intoxication will have. So in the CSCD, okay, these are the stages of alcohol intoxication. So first E is for euphoria, the next E is for excitement. Okay, so euphoria, excitement, then comes confusion. After confusion, when you're talking about someone to do with the levels of coma and the likes of consciousness there, after after that, after confusion, someone may go into stupor. After stupor, someone may go into coma, and then death may result. So the cardinal here that you have to look at here is euphoria and excitement. The rest you can let it to consciousness level, how it can be altered. So to start with confusion, okay, there will be stupor, coma, and then death can come in. Okay, so what are some of the clinical features that can be seen when our patient becomes euphoric? There is difficulties in concentrating. The patient becomes talkative. There is lowered inhibition. There is brighter color in the face, and then you also see finer motor skills tend to lack when one is in the euphoric stage. Okay, in the euphoric stage, fine motors just holding a glass becomes a problem. You start dropping things, so that may constitute fine motor skills. Okay, then there is the excitement stage of alcohol intoxication. Okay, in excitement stage, senses are dulled, there is poor coordination, patient feels drowsy, there is a beginning of erratic behavior, there is slow reaction to time, and impaired judgment. With this excitement, that's why we say don't drive and drink, because when you drive and drink, you may be in the excitement stage where there's poor coordination, you are feeling drowsy, and your judgment is impaired as you are driving. So it may lead to risk behavior that may lead to death. Okay, so alcohol intoxication becomes a medical emergency. Then stage three is confusion. In confusion, we see exaggerated emotions, difficulties in walking, blurred vision, there is slurred speech, okay, and then sensation to pain is the doubt. There's response to pain. So confusion state here, we see that when you're watching a movie and there is someone who say, "Oh, in that military injury, these people were given alcohol because in alcohol, pain is doubt, that is in the confusion state." Okay, so the transmission of pain is affected, so pain is doubt. Then there is four, stupor. Stage four to alcohol intoxication is stupor. In stupor, patient can no longer stand or walk. They may start vomiting. Okay, patient in stupor goes into unconsciousness. Okay, there will be decreased respiration. Okay, or there is decreased response to stimuli. Patient becomes apathetic. So that is in stupor. In stupor, the level of consciousness is affected of the patient, that they become less aware to environmental stimuli. Okay, so the level of consciousness is changing to stage 5. In stage 5, patient is in coma. So when the patient is in coma, it means they have become unconscious. There is low body temperature. Okay, there's low body temperature, of which, let's say, hypothermia may possibly lead to death. There is shallow breathing, of which depressed respiration may lead to death, and also pulse is affected. Okay, so death in alcoholism may result most likely because of depressed respiration. So, depressed respiration may result in a death. So these are the stages of alcohol intoxication. Unique to stages of alcohol intoxication is euphoria and excitement. Unique to the stages of consciousness is confusion, stupor, coma, and the death. Okay, so now let us have a brief pathophysiology of alcohol intoxication. Alcohol is metabolized by normal liver at the rate of about 1 ounce, okay, every 90 minutes. Okay, 1 ounce every 90 minutes. That is 1 hour 30 minutes. Now, an abnormal liver with conditions such as hepatitis, cirrhosis, gallbladder diseases, or cancer, it will have a slower rate of metabolizing alcohol. Ethanol is metabolized to acetaldehyde by alcohol dehydrogenase, abbreviated as ADH. Okay, so ethanol is a chemical component that is found in alcohol. So it is metabolized to acetaldehyde by an enzyme known as alcohol dehydrogenase, okay, which is found in many tissues, including the gastric mucosa, that is the mucosa lining of the stomach. Now, acetaldehyde is metabolized to create, acetaldehyde is metabolized to acetate by acetaldehyde dehydrogenase. Okay, acetaldehyde dehydrogenase. Now, this one is abbreviated as ALDH. Okay, which is predominantly found in the liver. So now, alcohol dehydrogenase is found in many tissues. Then acetaldehyde dehydrogenase using that is acetylcholine, using the enzyme acetylcholine synthase. Okay, so we are saying acetate, which is used by the muscle cells to produce acetylcholine A, using the enzyme acetylcholine synthase. Okay, then the acetylcholine A is then used in the citric acid cycle. It takes roughly 90 minutes for a healthy liver to metabolize a single ounce, okay, of which we have mentioned this, that for a normal liver, for 1 ounce it will take about 90 minutes, okay, so that it can metabolize the alcohol content. So now, how then do you diagnose alcohol intoxication? So without relief with proper metabolism of alcohol, it will lead to build up. Okay, it will lead up to build up of alcohol, hence bringing about toxic effects. So the blood alcohol content, also called blood alcohol concentration, blood ethanol concentration, or blood alcohol level, is most commonly used as a metric of alcohol intoxication. So, in the blood, for instance, blood alcohol content of 0.10 means that 0.10% of a person's blood by volume, okay, is alcohol. Now, let us look at management of alcohol intoxication. Acute alcohol poisoning is a medical emergency due to the risk of death from respiratory depression. Okay, and also because of inhalation of vomitus that may affect the patency of the respiratory system. Okay, so when the patient becomes unresponsive in the stupor stage and they are vomiting, it may block the respiratory system, hence compromising extent of oxygen within the airway. For acute alcohol poisoning, we strive to stabilize the patient and maintain a patent airway because of the impaired respiration. So we have to protect the patient's vitals by monitoring airway, breathing, and circulation. Okay, the person with alcohol intoxication is thought to be at risk of severe respiratory depression. Okay, and you might have to use an endotracheal tube to protect the airway and assist the patient with the breathing. You have to protect the patient's airway also from aspiration of stomach content, okay, because the patient may start vomiting. So if they aspirate the gastric content that has acid, okay, gastric acid there, patient may be predisposed to aspiration pneumonia. Okay, so when one takes alcohol, sugar levels are likely to be depleted because of the easy metabolism of alcohol. Since patient who has got their gastric content or their stomach filled with alcohol, they may tend not to eat other foods. Hence, they may have hypoglycemia or they are at risk of having low blood sugar. So, in rehabilitating this patient who is at risk of hypoglycemia, which may lead to unconsciousness, you may have to give 50% dextrose solution, and then you also do a saline flush to reduce blood alcohol content. Okay, so this patient, because of reduced sugar levels, which is needed to produce energy and heat, they are also predisposed to hypothermia. So you may need to cover the patient with a lot of beddings. Okay, we might need to cover a patient with a lot of bedding in order to prevent hypothermia. What are some of the prognosis of alcohol intoxication? A normal liver, as we have said, can detoxify 1 ounce in 90 minutes. So a person who takes alcohol and has a problem with the liver, this is a person who is at risk of having alcohol intoxication. So proper health education needs to be given to people that take alcohol and have liver problems that they risk going into a coma. They risk becoming unconscious because of alcohol intoxication. And if one has an episode of uh, um, change the conscious level after taking alcohol, it could be a sign that they have a liver problem or they have a liver problem to do with the metabolism of alcohol. Okay, so there are people who drink heavily. They have been taking alcohol. Now they start now taking, because of tolerance, they take a lot of alcohol. Even these, they are predisposed because the liver can become overwhelmed to metabolize the alcohol that they have taken. So the alcohol levels may reach dangerous levels. Okay, so within this lesson, we have established why alcohol intoxication is an emergency because patients may end up becoming unconscious and this may interfere with airway, breathing, and circulation. Okay, and we have also established how these airway can be affected because of the vomiting that the patient has and also alcohol. interferes with the central nervous system, affecting respiration. Okay, so now another condition that we need to look at as a psychiatric emergency is drug poisoning. Drug poisoning may come in suicidal attempt. Drug poisoning may also come because one lacks knowledge about use of certain drugs. Drug poisoning may come because one does not know or did not receive proper information on how to take a certain drug. So, poisoning can result from an overdose of either prescribed drugs or drugs that are bought over the counter. It can also be caused by drug abuse or drug interaction. When you say drug interaction, you take one drug and then you take another drug. These drugs tend to interact within the body, bringing about a multiplier effect or a multiplier and Z effect that may affect one's physiological function. Accidental and intentional poisoning or drug overdose constitute a significant source of aggregate morbidity, mortality, and healthcare expenditure in most countries. So here it's important that when you give drugs to the patient, explain to them that when you're taking this drug, you're not supposed to take drug ABC so that they know which drugs can bring about undesired effects. The drug that you might give may be to help the patient with their condition, but when you take another drug, it may affect the person in a negative way and bring about those undesired effects. The effect may vary depending on the type of drug that one has taken. Remember, some may take paracetamol to commit suicide, in their suicidal attempts. So you need to know the antidote if someone takes paracetamol. Others may take opioids, so it's important that you give the patient the antidote for opioid poisoning. So that is on a drug poisoning. Okay, so here paracetamol, aspirin, and also some of the signs and symptoms of one with aspirin poisoning we try to discuss within this lesson, and then paracetamol. So there's issues of upper abdominal pain, nausea, ringing in the ears. All these are signs of poisoning when one takes these drugs. Okay, but here the bottom line is knowing what drug to give in terms of NSAID poisoning, what drug to give in terms of opioid poisoning. What is the nursing management of any of these drug poisoning? Is that you have to arrange for the you have to arrange the goal is to maintain breathing and circulation, and also arrange for the removal of the a casualty from the state of unconsciousness to the state of consciousness. Hence, you're going to help them so that they can be in a comfortable recovery position, okay, and ask relative vital questions that will help you establish the drug that might have led to the poisoning. After that, then you can reassure the family that everything is being done to correct the situation. Without you knowing the actual drug that has caused poisoning, you are going to do a lot of guesswork or general measures in order to reduce poisoning. The use of milk, you get it, to reduce absorption of drug-induced poisoning. The use of charcoal powder to reduce the effect of drug poisoning. Okay, and also starting of IV line in order to dilute the drugs that might have caused poisoning. So you have to monitor and record vitals of the patient in order to help patient stabilize. Okay, so depending on the clinical picture that the patient has presented, we are saying this patient is at risk of dying. So early intervention and treatment and also giving of antidote will help us to recover this patient. Then there's drug and substance abuse as the 63 psychiatry emergency, drug and substance abuse. So, a chemical substance which, when taken, changes the functioning of the body and the mind. Okay, body and the mind. We are looking at this as a drug. Okay, so in now drug use Using a drug for its intended purpose, or use of antimalarial tablets or treats malaria, Panadol to relieve, let's say, signs and symptoms, eh, that would be just okay. But when you look at drug abuse, okay, we are looking at an intense desire to use increasing amount of a particular substance or substances, okay, to the exclusion of other activities. There will be improper use of drug that may lead to substance abuse. Like, for instance, taking Piriton for sleep instead of using it to treat allergies or sniffing through conditions of sniffing through condition, we are going to term this as the drug abuse. There can be categories of drug abuse like illicit drugs, okay, like heroin, cocaine, okay, and marijuana. These fall under illicit drug abuse. Then there is also licit drug abuse. For example, alcohol, okay, tobacco. Okay, so these are legal drugs. So these legal drugs, if you abuse them, okay, then it will lead to substance abuse or drug abuse. Commonly abused drugs that we have within our communities may include alcohol, marijuana, cigarette, okay, but it will depend the area that you are in. But otherwise, heroin, cocaine constitutes some of those drugs that are abused within our communities. Causes of abuse or drug abuse or substance abuse may include peer influence, low self esteem, media influence from TV, magazines, or internet. Then, rebellion against parents, teachers, or religion may cause one to abuse drugs. Others tend to abuse drugs because of curiosity or lack of knowledge about drugs, or they may abuse drugs because their role models are using those drugs. Other causes of predisposition to drug abuse include frustration from home, school, or workplace, and the likes. Then others abuse drugs because of false ideas and perceptions that have been put forward about certain use of some drugs there. Others abuse drugs in order to enhance their memory. So, because of poor memory, they want to enhance their memory, they tend to abuse drugs. Others, because of reduced reasoning capacity, they feel that if they start using those drugs, they need to improve their reasoning capacity. For others, it's just truants and a poor performance in school, which may cause them to abuse drugs. Okay, others they have abused drugs because of poor concentration. Okay, and when one abuses drugs, it may lead to a lot of it may lead to predisposition to a lot of condition. Dropout from school, early pregnancy, may lead to predisposition to HIV, increased crime, okay, and theft. It may lead to poor health, personal neglect, withdrawal. These can be just some of the consequences of drug abuse. Apart from that, we can talk about drug overdose leading to death, physical and psychological addiction to these drugs. Okay, personal guilt also follows for people that abuse drugs. So, marijuana is one of the classy social drugs that are frequently used within my community of interests. Okay, so people may have different reasons as to why they abuse those drugs, but it may bring about depression. Okay, it may bring also about depression if one is using that because others may use to cure depression, but it may bring about depression. Okay, so it is important that within our community we look at a lot of preventive measures to substance abuse. So you can develop a good reading culture that will make people stay away from that peer pressure of using these drugs. You can teach children on how to choose their friends wisely so that they don't indulge themselves with those that may bring about negative reference. Okay, appreciate you can appreciate and identify and help children pursue purposeful life, teach children about assertiveness, self awareness, okay, so that they can try to grow in a responsible members of societies. Okay, you can also bring in networking with some people that have survived from drug abuse and now they are living a life outside drugs, which is now normal. There's no addiction or things that are forcing them to steal because of the predisposition that drug abuse brings in. Okay, so in this lesson, we are looking at psychiatry emergencies. First part, we looked at suicidal attempt, aggression, and depression. Then the second part, we have looked at DAD. Okay, so in DAD, we have looked at also three conditions as some of the predisposition to drug abuse. So in DAD, there is alcohol intoxication, there is drug abuse, and also there is substance abuse, or there's drug abuse, there is substance abuse, okay, and there's alcohol intoxication as some of the conditions that may lead to psychiatry emergency. Okay, so a sad dad constitutes psychiatry emergencies. Suicidal attempt, okay, apart from suicidal attempt, we are saying A for aggression, D depression. Then dad, that is drug abuse, A alcohol intoxication, then the other D is D it has to do with it. Apart from drug abuse, there's drug and substance abuse as some of the conditions that may constitute psychiatry emergencies. Okay, so this lesson uh, will help you know most of those conditions that constitute psychiatry emergencies. And if you have a very good clinical picture of how these conditions will present, then it will help you to understand why it is a psychiatry emergency. For instance, if someone comes with a drug abuse as or substance abuse to the hospital, they may come in unconscious state. So if they come in unconscious state there, we are looking at it as a psychiatric emergency because we want the patient to come out of that unconsciousness. Out of alcohol intoxication, it may come as a psychiatric emergency. And our goal is to help the patient come out from this intoxication as it may affect airway, breathing, and circulation. Okay, so these are some of the things that we have tried to appreciate within this lesson. Okay, so if at all we have not tackled any other condition, please, that constitutes a psychiatry emergency, we can always research on that and give us feedback. But these are the cardinal, okay, these are the cardinal conditions that constitute psychiatry emergency. And we have simplified them for you. And always, please use these conditions to prepare yourself for any clinical battle of the patients that may come possibly with these conditions so that you can treat them with the proper therapy that it is deserved. Okay, so know what to do in an emergency. And psychiatry emergencies is not just about airway, breathing, and circulation. Psychiatry emergencies like aggression just requires you to do some behavior modification, do some restraining to the patient so that the patient may not harm self or others. Okay, when you're talking of an emergency, it is anything that affects the airway, anything that affects breathing, anything that affects circulation. Okay, so then when you are resuscitating the patient, you have to look at the airway, remove that thing which is compromising the airway. Breathing, you need to know the normal parameters that breathing is within the normal range. Circulation, if one is vomiting a lot, it is affecting circulation. If one is bleeding, it is affecting circulation. We saw that in alcohol intoxication, that the patient vomits a lot to an extent of being dehydrated. Okay, so please, we appreciate feedback and together let's fight, okay, this disease called ignorance. So from me, I'm saying thank you and keep studying.